Hello masterminds, welcome back to class. Today we are talking about a new class of psychiatric medications called antidepressants. In this lecture video, we will talk about what they are, how they work, the types of antidepressants we have, and then their side effect profiles. That said, ladies and gentlemen, if you are ready, grab your pens and your notepads because class has started. Antidepressants are a broad group of psychiatric medications that are used in the management of depressive disorders, such as depression. However, they are used in the management of some anxiety disorders, such as post-traumatic stress disorder, obsessive-compulsive disorder, and generalized anxiety disorder. Again, they can be used in the management of some forms of pain, such as chronic pain and neuropathic pain. Now that we understand what antidepressant medications are, let's move on to their mechanism of action, or how they work. The mechanism of action of an antidepressant depends on the kind of antidepressant it is, but essentially, most antidepressants work by increasing the amount of certain types of neurotransmitters that are involved in regulating an individual's mood and motivation. These neurotransmitters include serotonin, norepinephrine, and dopamine. I will make separate lecture videos dedicated to how each of the types of antidepressant medications achieve their therapeutic effect by affecting the levels of serotonin, norepinephrine, and dopamine. But for now, I want it to be clear that antidepressant medications generally modulate the amount of these neurotransmitters in the brain to improve the mood of an individual with depression. This leads us to the types of antidepressants. There are several forms of antidepressant medications, but most of these can be categorized into 5 main types. We have selective serotonin reuptake inhibitors, or SSRIs. We also have serotonin and noradrenaline reuptake inhibitors, or SNRIs. There is what we call tricyclic antidepressants, or TCAs. There is monoamine oxidase inhibitors, or MAOIs. And finally, we have a fifth group called atypical antidepressants. I'm going to explain these types of antidepressant medications very briefly to promote your understanding of the topic we are discussing here. But in the coming weeks, I'm going to upload separate lecture videos that are dedicated to explaining the types of antidepressant medication into much details. SSRIs, or selective serotonin reuptake inhibitors, work by blocking the reuptake or the reabsorption of serotonin, therefore increasing the availability of the neurotransmitter serotonin in the synaptic gap, which in turn improves the mood of an individual with depression. SSRIs are typically the first drugs of choice in the management of depression because they have fewer side effects, they are well tolerated, and relatively safer in overdose. Examples include fluoxetine, paroxetine, citalopram, escitalopram, and sertraline. SNRIs, or serotonin and noradrenaline reuptake inhibitors, work in a similar fashion as the SSRIs. The difference in their mechanism of action is that SNRIs block the reuptake or the reabsorption of both noradrenaline and serotonin. They are notoriously known for causing withdrawal symptoms when stopped suddenly and can cause hypertension as a side effect. Typical examples are venlafaxine and duloxetine. TCAs, or tricyclic antidepressants, are probably among the first kinds of antidepressants to be produced. Typical examples are amitriptyline, imipramine, and clomipramine. Tricyclic antidepressant medications achieve their therapeutic effect by blocking or inhibiting the reuptake of serotonin and noradrenaline. But unlike SNRIs, tricyclic antidepressants are more non-selective in their approach and affect various other receptors, such as anticholinergic, histaminergic, and alpha-1 adrenergic receptors. Because of their non-selective approach to blocking various receptors in the brain, they carry the risk of causing a wide range of side effects. Furthermore, they can be comparatively very dangerous in overdose. Next on the list are monoamine oxidase inhibitors, which achieve their therapeutic effect by blocking the enzyme monoamine oxidase. To understand how these medications work, you need to understand the enzyme monoamine oxidase. Monoamine oxidase is an enzyme that breaks down monoamine, which begs the question, what is monoamine? Monoamine is a collective name for a group of neurotransmitters such as serotonin, noradrenaline, and dopamine. Therefore, when we say monoamine oxidase, it is an enzyme that breaks down serotonin, noradrenaline, and dopamine. What these medications do is to inhibit the action of monoamine oxidase, which therefore inhibits the breakdown of serotonin, noradrenaline, and dopamine, and in turn promotes their availability in the synaptic gap, therefore achieving their therapeutic effects such as improved mood. It sounds straightforward and very understandable how monoamine oxidase inhibitors work, but their use is not encouraged in several countries because they carry a serious risk of hypertensive crisis and very serious drug and food interactions. Typically, people taking this class of medications should avoid foods that are rich in tyramine, such as aged cheese, fermented foods, examples, pickles, and processed meat. Common examples of monoamine oxidase inhibitors are phenelzine, isocarboxazide, and tranylcypromine. And finally, we have the atypical antidepressants. These are also sometimes called miscellaneous antidepressants. These medications are classified as miscellaneous or atypical because their mechanism of action is not always straightforward or is not thoroughly known. Common examples are mirtazapine, bupropion, and trazodone. Atypical antidepressants are normally used when SSRIs are not well tolerated by patients, and they normally have different side effect profiles, such as impaired concentration, sweating, and tremors. We will end today's lecture here. In the coming weeks, I'll be uploading separate lecture videos that are dedicated to explaining each of the types of antidepressant medications into much details. Please like, subscribe to the channel, and share with others who will benefit from it. As usual, if you have any questions, please drop it in the comments below, and I'll do my best to respond to these. Until next time, this is Masterminds Nelson. Ladies and gentlemen, class has ended.